When it comes to reconstruction after mastectomy, typically the reconstruction is done in stages. Usually there's a first and a second stage. The first stage reconstruction is typically the placement of a tissue expander. It is sort of a thick plastic bag that is progressively enlarged. It creates and expands the space where the breast was. Usually after mastectomy, the area where the skin has been saved and where the tissue expander is deflated to make sure that we have enough blood supply coming to the mastectomy site. And then progressively, the tissue expander is enlarged, the area is expanded up to the size we choose, or maybe a little bit larger. So then, what's second stage reconstruction? Well, that comes usually months later. And one of the questions I've been asked is, if I had a first stage reconstruction with a tissue expander, can I have as a second stage reconstruction the rotation of a flap, such as a deep flap or a tram flap or latissimus dorsi flap from the back to now fill in that space? And the answer to that question is an absolute yes, you bet. In fact, there are papers in the literature that suggest that's a better way of doing things, particularly in the setting of nipple-sparing mastectomies. I have several videos on breast cancer answers about nipple-sparing mastectomy, and the literature that I have read suggests that probably the better way to do that is to have a tissue expander initially, progressively enlarge, and then either at a second stage then put in saline or silicone implants, or if you prefer, autologous tissue, which can come from the abdomen, from the back in various forms. So the answer is that in reconstruction, where there's a first and second stage, certainly autologous tissue can be delayed to the second stage. Another type of reconstruction is mastectomy first, no reconstruction at the time of mastectomy because, as an example, somebody needs radiation therapy, and then doing the reconstruction later on by rotating a tram or deep flap or latissimus dorsi from the back with a small, when you do that, often there's a small implant if we're bringing up a latissimus dorsi flap. So what I want to encourage you to do is be working with a team of people who are used to all the options when it comes to reconstruction. As you've heard me say multiple times, always be working with a multidisciplinary team, particularly a breast surgeon who's used to working with a single or group of plastic surgeons that know all the options. Figure out then what's the right option for you. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.